Hi everybody, welcome to another video. Thanks for tuning in. For those of you guys that are new, obviously welcome to the channel. My name is Dr. Elise Tercy and I practice functional medicine here in New York. For those that are always tuning in and staying up to date with everything, of course, welcome back. As you guys know, I love to make videos about things that are coming up in clinical practice, things that I'm seeing in practice, kind of what's going on in the world. And this week we're talking about some common blood work deficiencies that show up for people, whether or not they have any clue that they're there or not. So if you're interested to learn about what things I see kind of as a provider when it comes to deficiencies from lab work or common, even I wouldn't say deficiencies, common ailments in blood work, then stay tuned. If you have been in my practice, then you obviously know I am notorious for comprehensive functional lab work, which means that I am looking at everything I could possibly learn about your health. I order vitamin mineral profiles, B1, B2, B3, B5, B6, B7, B12, B9. I'm looking at zinc, iodine, glutathione, CoQ10, selenium. I'm looking at full thyroid hormone profiles, T3, free and total, T4, free and total, antibodies, heavy metals, mycotoxins, mold. I try to really check in with the body and have the body communicate with me as to what's going on from a chemical and physiologic standpoint. So I'm notorious for that. If you guys have never done functional medicine or comprehensive lab work, then you're probably like, oh, I didn't know that these things were actually available to test for. So a lot of the nutrient deficiencies or common blood work findings that I find that are classic across the board, we'll start with the two easier ones or two obvious ones: low vitamin D and then low iodine. Those are more of the vitamin and mineral profile. Those fall under, I should say, the vitamin and mineral profile cascade. I would say vitamin D is a very common nutrient deficiency, even if you're outdoors. So a lot of people share with me, they're like, well, I'm outside, right? Like I work outside, or I just got back from a trip somewhere where it was warm and I was there for 7-10 days. Not enough. It's not enough. Our body uses vitamin D in so many different ways. We actually call it hormone D because of how important it is for the tissues. And vitamin D is actually a co-regulating enzyme and factor for so many different things when it comes to immunity and gut health and healing the body in terms of repair. So we do require a lot more than people think. A lot of my people out there are realizing that they're deficient and also that they're probably not absorbing it. So just because you do take a supplement doesn't guarantee the absorption. If you have digestive issues, bloating, reflux, constipation, diarrhea, gastritis, acid reflux, you're taking any pharmaceutical that is a proton pump inhibitor or H2 receptor blocker, it will lower your body's ability to absorb vitamins and minerals. So by default, you could take something and then not realize that, oh, I'm actually not absorbing it because of the pharmaceutical I'm using that's blocking absorption. So Prevacid, Tagamet, and Zantac, all of those, they block hydrochloric acid production in the stomach, and we do need a very acidic environment to process and digest food, which does require hydrochloric acid. So if you're thinking that by just supplementing that you're going to get your vitamins and minerals and nutrients, that may not be the case if you're actually dealing with an underlying digestive issue, or you're on certain pharmaceuticals that can block the absorption capacity. So those little clinical side note there. Vitamin D, now reference ranges are anywhere from like 17 to 100, depending on what lab you look at. Most people, I would say, if I had to guess, on average are like 30 units. And we do need vitamin D to be processed with vitamin K. So sometimes it's A, you're not absorbing it. B, it's not the right form. D, it's not therapeutically dosed, high enough dosage. So in functional medicine, holistic, we dose high. 10,000 IUs, 50,000 IUs, in some cases 100,000 IUs, depending on how low people are. I've seen people that have vitamin D levels that are 10, which is bone-breaking low. And a lot of times, if that's the case, then they're often dealing with a digestive issue behind the scenes. So if someone's dealing with osteopenia, osteoporosis, teeth are coming out, some of these things are cracking bones, breaking bones, fracturing things, we do want to say what's going on in the gut, because you're probably not processing things fully, which means your vitamins and minerals are rendered kind of null and void. Iodine, so our soil is actually not iodine rich, and our foods are no longer fortified with iodine as they used to be. Everybody, especially in the holistic space, uses pink salt, right? They use Himalayan, Celtic salt, sea salt. A lot of them, more often than not, are not iodized. They do not contain iodine. And so it renders us to be deficient in iodine. Now, iodine is a required nutrient and element for thyroid hormone conversion. It also does really help if someone's dealing with fibrocystic breast disease or even certain breast cancers. Iodine does have a lot of reception in the breast tissue. And so we do need iodine as it's a co-regulating factor for immunity and for basically our thyroid, which is our entire metabolism. So that's another very common thing. I would say 100% of people, when I'm looking at their blood work, are iodine deficient. We don't eat foods that contain iodine in them as much, which are a lot of like sea vegetables, like certain things that may be more of the like wakame, kelp, in that family. So that's a common thing. And then our food, our soils, just not the same amount of iodine in it. Those are the two common nutrient deficiencies. What I also find for people is subclinical hypothyroidism. And what that means is that their lab work looks normal, but in the reference range of the normal, they're leaning towards a lower end of the spectrum. So for example, let's just say, let's just pretend we're talking about a TSH, which is a thyroid stimulating hormone. Well, let's call it 0 to about 4.5. That's kind of the window of where we want to live. 2.50 is like perfect, right? Like that's like perfect in the middle, great. Some people, well, their doctor says thyroid looks good and their TSH is maybe 4.36. They're leaning on the higher end, which would be hyper. Actually, that's not right. That would be more hypothyroid because their hormones would be low. But the point of the story is, if someone's blood work is showing some signs that they're leaning towards one place, a lot of times they get very dismissed by their provider because they do look like they're in the normal window. However, when I'm looking a little bit more in depth, what we're finding to be true is that, yeah, you're in the window, but you're not optimal in the window. So kind of the best analogy I can give is like students in school studying for exam and they give us the grading scale. So I think it's, if I'm not mistaken, I want to say like 60 to 100. And let's call a 60% either a D or an F. Well, sure, maybe you passed the exam, you got a 62%. But did you really pass the exam? Do you really have enough knowledge to understand the material and maybe reverberate it back? Probably not. So yeah, you passed, but like bare bones passed. So the thyroid is one of the ones that oftentimes can take some time for people to get a real diagnosis of hypothyroid, which is low thyroid hormone, low T3, low T4. They're not producing or they're not metabolizing enough hormone. And that's another thing I want to bring up clinical pro-wise is it's possible you're not producing enough, which the production of the thyroid hormones comes from the gland itself. It does require iodine and certain things like selenium in order to have that conversion process happen. The conversion process takes one version of thyroid hormone and makes it active or more bioavailable. Sometimes there's an enzyme deficiency in that conversion process that's missing. Another thing that could be happening is that your thyroid hormones are actually converted in your liver. You don't convert in your thyroid per se, you convert in your liver. So sometimes it's not about the thyroid not producing enough. The thyroid could be producing just enough. It's just that they're not converting or mobilizing or metabolizing enough of it. So that's another very common nutrient deficiency I see in blood work is that someone's actually low with their thyroid hormone, but their doctors are saying it's fine because in theory it is fine. It's not fine for the body. The body is feeling symptoms of I'm tired, I'm cold, my hair is thinning, I'm really like sleeping often, I don't have energy, maybe I'm dealing with infertility. But from a blood perspective, yeah, they're in that range, which we don't want to just pass exams with D's. We want to really like understand the material. So same thing goes true for the body. Another very common thing I find for people is positive Epstein-Barr virus reactivation, where they're coming in with triple-digit numbers or very high viral titers. Now, not always when someone does have high Epstein-Barr viral titers does a problem occur. However, more and more research, I think just last week I read an article about the connectivity of multiple sclerosis to EBV, Epstein-Barr virus, which is herpes simplex 4. So I am more interested to know when someone's saying, I am tired, I do have chronic fatigue syndrome, I do have joint pain, sometimes, feeling, well, I would say feeling exhausted, feeling really run down, feeling like your glands are swollen or getting what's called lymphadenopathy, unknown fevers, spiking fevers of unknown origin. I will ask questions about the immune system and the viral load to see if the person is actually clinically correlated. So someone could have Epstein-Barr virus numbers that are high and they have no symptoms. They're like, no, I don't feel anything. I'm not dealing with any of those things, which that's wonderful, right? But for people that are saying I am symptomatic and I do have triple digit or high numbers, 600, 750, we can tell that by the blood work. That's where my ears perk up a little bit to say that you're likely dealing with an immune system reactivation of old viral load. Because when we have a virus, we always have the virus. Viruses don't go away. They just go dormant and then they become reactivated. So you're never curing a virus. It's just not the way it works, but they kind of shed their skins and they produce these toxic byproducts and they produce their DNA, they shed their DNA, and then they can create symptoms for us. And obviously we feel those symptoms. So that is another very common thing that people say, no, I never had mono, which Epstein-Barr is the virus that causes mononucleosis. They're like, I never had it. And I'm like, but you did have it, you just didn't feel it, right? There's times that we could be asymptomatic where we don't feel it. There's no symptoms in us, but there is a memory and a remembrance of the fact that we had exposure to it. So that's another very common one. And I really, really work a lot with Epstein-Barr virus and people that have autoimmunity or have developed different types of lymphomas from Epstein-Barr, because there is a direct correlation connection between Epstein-Barr virus and certain lymphomas. And so I just wanted to kind of clarify that as well. So those are the common things I do find. I also find very low levels of glutathione. So glutathione is our body's most potent antioxidant. All of us make it. It's produced in our liver. And a lot of people are really deficient with glutathione as well. It helps with skin regeneration. It helps just kind of repair cells that are damaged, that have undergone apoptosis or cell death. Cells die and then they rebirth themselves, right? They kind of grow new. And so if someone's dealing with like a sluggish liver, or if someone's dealing with really just like weight issues, metabolism issues, metabolic issues, I want to know what the glutathione levels look like, because often they're inside their liver, their filter is not working. It's like, imagine a dirty fish tank and the filter is not on the fish tank. So all that stuff's just sitting, the sediment's just sitting in there. And so glutathione helps be the filter to kind of clear the body of environmental toxins and pollutants and mold and things that we're always kind of pinged by or bombarded by. It's part of life, right? We live in a world where there are bacteria species and there are viruses and there is metals and there are molds and there's critters everywhere. Well, glutathione keeps the cells active and alive. And if we don't have enough of it, our detoxification pathways can get blocked and stagnant, and then that creates problems for the immune system. As we all know, the liver is actually the largest immune organ. It's a massive lymph node. So it's important we have good, healthy glutathione levels. So those are just the common things I see for people. There's a lot of other things. And honestly, everyone's so individual. I wish I could say that this is true for everybody, but my best suggestion is to work with someone that can support you and really look and be very thorough with your lab work to make sure that they're checking in with every organ system: liver, gallbladder, spleen, pancreas, immune profiles, celiac disease issues. Are you having any issues with mold or Lyme or mycotoxins or tick-borne disease or co-infections from self-infections? All these things can play a little bit of a role. So I hope that that was helpful and that you guys maybe learned what to ask for to some degree on your next round of blood work. And like I said, supplements are great and there's a time and place for them, but this video is not to say go out and buy all these supplements that are glutathione based or vitamin D or iodine based, because you may not be absorbing that. Okay, so just little buyer beware when it comes to the clinical pearl there. If you guys like this, give it a thumbs up, and of course be sure to click the subscribe button so that you get up to date and stay up to date with all of the videos that I make on this channel. I'll see you guys next time in the next video.